The story I will share with you today is nothing short of a miracle. And a placenta attachment to any organ or any tissue surface in the abdomen is extremely dangerous, or when the placental site bleeds. It is a significant amount of bleeding, and you have minutes to sustain the life of the mom. It seems like always around the holidays, we are reminded of the miracles that exist around us. And like most miracles, it is a reminder that our medical field is a combination of science and the unexplained, both under the umbrella of God. So I'm excited to share the story with you today. It includes a surprise and just amazing collaboration of a healthcare team that did incredible work to help the survival of both mom and baby. Let's get into it. This story takes place in Los Angeles, California in August of 2025, just a few months ago. And it is one of the most incredible stories ever. But there are certain things that we should learn from this story, things that I would love to leave with you so that you have better understanding of just how miraculous it is. And hopefully explain some of the things that weren't explained in some of these standard news reports about this particular family. But before I do so, I just want to welcome all those who are visiting us for the very first time on this platform. If you are here for the first time, please remember to hit the subscribe button as we do our very best to share and keep you updated so that other individuals will be able to have access to the information we share today, just as you have. We try to bring you the most updated scientific-based information so that you feel more empowered and informed. So we invite you to hit the subscribe button, comment, like, and share. And if you feel so, go ahead and hit the thanks button. That allows us to have the funding necessary to continue to put together these topics and also to participate in community-based events. So this story, as I mentioned, happened in Los Angeles, California this year. And it is one of the most incredible stories, not just because of the outcome of the story. Thankfully, it's a great outcome, but also because of just how collaborative the efforts were for the team that took care of this young woman. It is a reminder of how beautiful medicine is when we are allowed to collaborate together for the good of the patient and the good of the public as a whole. So the story I am honored to share with you today is the story of Susie Lopez. Susie Lopez is a 41-year-old nurse from Bakersfield, California. And she had known that she had an ovarian tumor for quite some time. It had been slowly growing. And it got to the size of 22 pounds, and she had opted to pursue surgery. Now, in the process of preparing for surgery in her preoperative evaluation, which oftentimes we will do certain types of labs, and of course, for our women who are in their reproductive years, we always want to make sure that there is no concurrent pregnancy to minimize any potential risk. And so Susie underwent her preoperative testing, which included a pregnancy test, and her pregnancy test, to her surprise, came back positive. So she went ahead and planned to share this news with her husband. They were on a date night at a Dodgers game, and she surprised him with the news of her being pregnant. Now, this was particularly a very joyous occasion because Susie and her husband have been trying to have a child for 17 years. So they've had 17 years of infertility. And here they are, pregnant surprisingly, unexpectedly. Initially, when Susie saw that she was pregnant or that the test was positive for pregnancy, the initial assumption was that perhaps it was a false positive, as certain types of ovarian tumors can produce hormones that can, including the ACG hormone, that can turn a test positive and in fact be a false positive, as Susie had suspected. She was truly pregnant. Interestingly, at the same Dodgers game, she suddenly began to feel ill. In fact, she had a sudden intense pain and opted to head to the hospital. So she had to Cedars-Sinai. At Cedars-Sinai, she underwent additional evaluation, which included an MRI to further evaluate her extremely elevated blood pressure that was noticed on presentation. Her severely high blood pressure was stabilized, and the imaging was then subsequently completed. To their surprise, behind the 22-pound ovarian tumor was a baby, and the baby had been living in her upper abdomen. In fact, the baby was right underneath her liver and sitting on her uterus, not in the uterus where the pregnancy should have been, but outside of uterus in the abdomen. Now, this was a particular surprise because one, it is very rare to find abdominal pregnancies. In fact, abdominal pregnancies are so rare that they're about 1% of all ectopic pregnancies. Not only was it a surprise because she had an abdominal pregnancy, but it was a surprise because the pregnancy appeared to be near full term. And the likelihood of a baby surviving an abdominal pregnancy and mom is extremely rare. And I will explain why in just a few moments. On August 18th, baby Ryu was born, a beautiful, healthy baby boy. Now, the delivery and care of baby Ryu and Susie required a team of 30 healthcare professionals, which included anesthesiologists, gynecological oncologists because of the tumor, maternal fetal medicine doctors, of course, the OBGYNs that would deliver the baby, as well as the pediatric team, the surgical techs that were involved. It was a massive coordination, but a very necessary coordination as the clinicians understood the risk that was ahead of them. Baby Ryu was born and did require respiratory support. The respiratory support was removed the next day, and baby Ryu had an extended stay of 2 weeks in the hospital. Now, I'm not certain if those full 2 weeks were in the intensive care unit or a combination of the intensive care unit and nursery. That I'm not certain. But baby Ryu overall did extremely well, considering that the mortality rate for a baby that is an abdominal pregnancy baby is anywhere between 40 and 90%, so extremely high. The far majority do not survive, and it's extremely high for those that are near term or approaching term for the obvious reasons, or maybe not so obvious. So I'll explain. Now, the placenta was attached to the abdomen. They didn't clarify exactly where in the abdomen, so I'm going to assume perhaps the abdominal wall, but I could be wrong. It's a complete assumption. But regardless, a placenta attachment to any organ or any tissue surface in the abdomen is extremely dangerous. The placenta is a very vascular organ, but it's also a very intrusive organ, and it will seek the area that provides it the most blood supply, and it will invade that tissue. Now, ordinarily, in the uterus, there is a layer that separates the placenta from mom's uterus. And in some cases where you have accretus, procretus, or incretus, you have an invasive placenta due to the loss of the layer of tissue that intervenes between mom's uterus and the placenta due to prior surgeries. More commonly, that placenta will then invade the uterus and become abnormally attached to the uterus. This is where the concern begins, because when a placenta is attached to an organ that's not the uterus, it will become invasive. The placenta is a highly vascularized organ, which means it draws and is filled with blood, and it demands a high amount of blood from the mom. Because of that, when a placenta is attached to an organ it's not supposed to be attached to, it is very difficult to separate it, and that separation can lead to hemorrhage. As a reminder, there is a significant amount of blood flow that heads to the placenta per minute during a pregnancy. It's more than a half a liter per minute. Just think about that. Think of what a half a liter looks like, and imagine that's more than that is heading to the placenta every single minute. That is a significant amount of blood, considering that the volume of blood in an average woman's body is anywhere between 4.5 to 5 liters. So you're talking about, on average, roughly about 10% of a woman's total cardiac output is heading towards the placenta to sustain the pregnancy. So when the placenta bleeds, or when the placental site bleeds, it is a significant amount of bleeding, and you have minutes to sustain the life of the mom. In this particular case, as they probably anticipated, Susie did hemorrhage after the delivery. They were prepared and had machines ready. There are certain things that can be done to stabilize a patient that is hemorrhaging. They were able to stabilize her, and she did receive 11 units of blood. So she received more than twice her blood volume. Keep that in mind. But like her robust son, Susie Lopez did extremely well and is so thankful that after 17 years, she has her baby boy. She had a prior teenage daughter. And so these are the beautiful miracles that we like to remember. Now, I do want to give you a little bit further insight on how an abdominal pregnancy can happen. So you may be wondering, how does an abdominal pregnancy even happen in the first place? Well, as I mentioned, they are extremely rare, but they can happen. So if we use our uterine model, you will see right here, this is the uterus, and attached to the uterus is the fallopian tubes, very much near the fundus of the uterus, which is the top of the uterus. The fallopian tube then ends in what we call the fimbria. And actually, I wish that they colored everything the same, but they didn't. This is the fimbria of the fallopian tube, which looks like finger-like projections, right? And they kind of just move like that, right? They have a function in allowing the egg to go into the fallopian tube and then travel within the tube where it will meet the sperm and be fertilized. Now, typically, a fertilized egg will then continue on to the uterus for implantation. But sometimes a fertilized egg will travel out of the fimbria and end up somewhere in the pelvis, can implant sometimes on the ovaries. So what's not visualized here is the ovary. The ovary is not attached to the tube. And I will say that there are a lot of anatomical diagrams that do not accurately document this relationship and location. The fimbria and the ovaries are near, but they are not attached. And so there's a gap between them, which allows for the egg to then go into the pelvis. Now, that egg can implant anywhere in the pelvis. Very often, it will, if it's an ectopic, it will primarily be in the tubes. So, eggs that don't travel far enough into the uterus, or travel backwards, or just kind of stay where they were fertilized. Those are the more common types of ectopic pregnancies. And as you can see, could you imagine a full-term baby in this structure? It won't happen, right? You will not find a full-term baby that survived the fallopian tube, because a fallopian tube can distend, but it has limitations in which it can distend. And once it's dilated significantly to the point of its extreme dilation or extreme stretch, it will rupture. And that's why oftentimes, if they are missed, fallopian tube ectopic pregnancies will rupture and lead to significant hemorrhage. Now, the pregnancy can be anywhere in the fallopian tube. In the more dilated part of the tube is the more common location of an ectopic pregnancy, but it can occur at just about anywhere in the fallopian tube. A pregnancy can also attach to the ovary itself, and that's an ovarian pregnancy. An ectopic pregnancy can also be found in the uterus, just not in the cavity of the uterus. It can be found higher up, implanted in the muscle, lower down, implanted in the cervix. So ectopic pregnancies can happen just about anywhere in the pelvis, more commonly, but rarely they can then travel into the abdomen and implant on some organ in the abdomen. Now, organs like the liver, which is very highly vascularized already, can lead to significant bleeding and hemorrhage of a pregnancy. And that's typically what would happen in most abdominal pregnancies, is that they ultimately lead to significant bleeding, putting both the mom and the baby at risk and having a very high mortality rate. So, just to give you a visualization of how this happened. Now, understand that this is the pelvis, right? This is your pelvis. Okay? This is your pubic symphysis. Many pregnant women are very familiar with this because this is the part that sometimes hurt in that third trimester towards the end as it starts to separate. Okay? So the uterus typically, because in early pregnancy, the uterus is still in the pelvis itself. So this uterus sits in the pelvis. So when we're talking about an ectopic pregnancy, this is earlier on in the pregnancy. It can implant anywhere in the pelvis. And so coming out of this pelvis, if you can feel your pubic area, that's pretty much the landmarks of where your pelvis is. And so could you imagine that the pregnancy then travels out of this entire pelvis and goes into the abdomen? That's why abdominal pregnancies are so rare. But nonetheless, they do happen. And when they do happen, they can be catastrophic. Because of all these things is why this story is so miraculous. She had the tumor for many years. And at the time when she's ready to remove the tumor, she finds out she is pregnant after 17 years of infertility, secondary infertility, because she had a child before. Then she finds out not only is she pregnant, but she's pregnant with a full-term baby who then survives an abdominal pregnancy and does very well and have very few health concerns, according to the neonatologist, and did very well and was discharged from the hospital in 2 weeks. Mom also did very well, and after receiving 11 units of blood being cared for by 30 personnel in the healthcare profession, she survives, goes home, and enjoys her new baby boy with her husband, who later recently graduated as a nurse. This is just an amazing story. I don't know this family personally, but I feel like learning what I've heard about this family, it couldn't have happened to a more precious, loving family. So we say, welcome, Ryu, to the world. What an entrance you made into the world. And congratulations to the Lopez family. And all the best in your continued recovery to Susie Lopez. What an incredible story. This is Dr. T, the hand behind the handle of Healthy Bump Club, right here on YouTube, and healthybump.club on Instagram. I thank you guys for watching today and hope that I have enlightened and brought some miracle to your holiday season. We thank you for being with us on this year. We still have another episode to wrap up the year, but just wanted to say thank you so very much for joining us throughout this entire year. For those of you who have supported us all along, I am so appreciative of you, and I look forward to seeing you in the next episode. This is Dr. T, just a friendly reminder, don't forget to comment, like, and share, and go ahead, why not, click that subscribe button, help us to get to the next 1,000 subscribers. We thank you guys for supporting.